Platelet counts. Platelet count is a blood test that measures the number of platelets in a person's blood. Platelets, also known as thrombocytes, are small blood cells that play a crucial role in blood clotting. A normal platelet count ranges from 150,000 to 450,000 platelets per microliter of blood. A low platelet count, thrombocytopenia, can increase the risk of bleeding, while a high platelet count, thrombocytosis, can increase the risk of blood clots. Platelet counts can be affected by various medical conditions, medications, and other factors. Why platelets are important? 1. Blood clotting. Platelets play a crucial role in the process of blood clotting, also known as hemostasis. When a blood vessel is damaged, platelets will rapidly aggregate at the site of injury to form a platelet plug, which helps to stop the bleeding. 2. Inflammatory response. Platelets also play an important role in the inflammatory response. When platelets aggregate at the site of injury, they release chemical signals that attract other cells involved in the repair process, such as white blood cells, to the site of injury. 3. Tissue repair. Platelets release growth factors that promote the formation of new blood vessels and tissue regeneration. 4. Cardiovascular health. High platelet count is associated with an increased risk of cardiovascular diseases, such as heart attack and stroke. 5. Cancer treatment. In cancer treatment, platelet transfusions may be given to cancer patients whose platelet counts are low because of chemotherapy or radiation therapy. What diet should be followed to maintain platelets? There is no specific diet that has been proven to increase platelet counts. However, eating a healthy diet that is rich in essential nutrients can help to maintain overall health and support the production of platelets. Here are some dietary recommendations to consider. 1. Fruits and vegetables. Eating a variety of fruits and vegetables can provide essential vitamins and minerals that are important for platelet production. 2. Lean protein. Eating lean protein sources, such as chicken, fish, and legumes, can help to support the production of platelets. 3. Iron-rich foods. Iron is important to produce platelets, and eating iron-rich foods, such as red meat, poultry, and leafy greens, can help to maintain healthy platelet levels. 4. Vitamin B12 and folate. Vitamin B12 and folate are important to produce platelets, and foods such as fortified cereals, fish, and poultry can provide these essential vitamins. 5. Hydration. Drinking enough water can help to support platelet production as well as many other bodily functions. It is important to consult a healthcare professional or a dietitian before making any drastic changes to your diet. They can help you create an individualized plan that meets your specific needs and any underlying health conditions you may have. Thanks for watching. Like and subscribe.